Welcome, SJSU nursing students. Nursing is a rewarding and humbling career filled with opportunities and challenges to make real differences in people's lives, especially in their most vulnerable time of illness and rehabilitation.
As semester 6 students, we remember how nervous we were when we started clinicals. We studied tirelessly in fear of failing our next test. Our hearts are beating out of our chests when we are doing our first IV stick on a real patient. The thoughts of harming a patient or even miscommunicating during clinical may paralyze us from taking opportunities to learn something new or new skills.
But what does a safe nurse look like? They pay attention to details, communicate clearly, speak up for safety, and they're also lifelong learners.
We have put together this video to help you learn about error prevention tools that you can use during clinicals. This error prevention toolkit aims to empower you in becoming cautious and detail-oriented nurses.
Our first characteristic of a safe nurse is attention to detail. One of the tools we can use to accomplish this is by using the STAR method. So how do we use it? S is for stop. Pause for 1 to 2 seconds to focus your full attention on the task at hand. T is for think, which means you should visualize the action and think and anticipate about what needs to be done. A is for act. Concentrate and perform the task. R is for review. Check for the desired results. So when would we use STAR? You can use it anytime you're going from thought to action, for any nursing skills or interventions, medication administration, or even entering data in the EMR. Let's try an activity. How would you use STAR when you are about to give digoxin to a patient with heart failure? The second characteristic of a safe nurse is communicating clearly. We can use a 3-way repeat and readback method. So how is this method done? First, the sender initiates communication and provides an order or request for the information to a receiver in a clear and concise format, such as SBAR. Then, the receiver writes the information and acknowledges the receipt by reading back the order of the request. Always carry a pen with you and a small notepad. If you don't have any paper, I've seen nurses write things on alcohol wipes, gloves, or gauze packets. Don't forget to properly dispose of patient information when you're done with these. Lastly, the sender acknowledges the accuracy of the repeat back with either "that's correct" or "no, that's not correct." If not correct, the sender repeats the communication. When would you use this method? You can use this method when obtaining or relaying verbal orders, critical lab values, or any information that's specific. Let's try an activity. For this activity, you are receiving a verbal order over the phone from the physician. Listen closely. Hi nurse, for patient 300, start an IV nitro drip at 20 micrograms per minute and titrate up for chest pain relief. Cardiac enzymes every 6 hours. 2 liters of oxygen and titrate to keep oxygen saturation above 92%.
Another method of communicating clearly that we can use is phonetic and numeric clarification. When you're communicating verbally, say the letter and follow it with a word that begins with the letter. Examples are A for Alpha, B for Bravo, C for Charlie, and D for Delta. And you don't have to use the military code. You can use other silly words like A for Apple, just as long as they're not words that are easily confused with another rhyming word. For numeric clarification, when you're communicating the numbers, each number is said individually. Here is an activity of reading back in order. You receive this call. This is the lab calling about a critical lab of a patient in 300. His blood glucose level is 40/50. To clarify this order, you say, patient in 300 has a blood glucose level of 450. Here's an activity for you to practice your phonetic clarification skills. How would you communicate this patient's last name? An additional method of communicating clearly is clarifying questions. When can you use clarifying questions? You can use these in high-risk situations, for information that's incomplete, or information that is not clear. And how can it be used? Ask yourself, as a critical thinking skill, does it make sense to me? Does it fit with what I know? Is it what I expected to see? Check with the policy. Charge a nurse or a more senior nurse. Ask your question in a way that will give an answer that improves your understanding of the information. Activity time! The physician verbally ordered for you to give 5 30 milligrams of phenobarbital PO at bedtime. How could you clarify this order?
Lastly, we can use the SBAR format to communicate clearly as well. So what is the SBAR format? Well, the SBAR is an easy-to-remember, concrete mechanism useful for framing any conversation, especially critical ones, requiring a clinician's immediate attention and action. It gives clinicians a specific, unambiguous way to communicate critical information to one another, leaving little room for error and minimizing the chance that a miscommunication will cause patient deterioration. So when can we use it? Well, during nursing handoffs and when communicating critical information to physicians. So how can we use it? Well, S stands for situation. You'll want to clearly and briefly describe the current situation. B stands for background. You'll want to provide clear, relevant background information on the patient. A stands for assessment. You'll have to state your professional conclusion based on the situation and background. And R stands for recommendation. You want to tell the person with whom you're communicating what you need from him or her in a clear and relevant way. So here are some tips to have a clear SBAR report. Organize information first so it's clear before communication begins. When presenting a briefing, be clear and concise, and use each element of the SBAR to communicate the relevant information. Finally, work with the other person to arrive at the required action. If he or she needs to clarify information or ask follow-up questions, assist with this. So now we'll do an activity. For this activity, I will provide an example for this SBAR report. Listen carefully to see if you can identify each category and what the problem is. Hello, Dr. Something Wong. This is Nurse Carl calling from No Mercy Hospital. I'm calling because Mrs. Smith on floor 6, room 6, bed 6, is having increasing dyspnea and is complaining of chest pain. She is also reporting some calf pain that started 3 hours ago. The supporting background information is that she had a total knee replacement 2 days ago, and she's been resting in bed for those past 2 days. About 2 hours ago, she began complaining of chest pain. Her pulse is 120 and her blood pressure is 128/54. She is restless and short of breath, and her pulse ox is saturating down to 90% on room air. My assessment of this situation is that she may be having a cardiac event or a pulmonary embolism, and that her condition is deteriorating. I recommend that you see her immediately and that we start her on O2 stat, get a 12 lead, and run some cardiac and D-dimer labs. Do you agree? Another characteristic that makes a safe nurse is speaking up for safety. We can do this by utilizing the ARCC acronym to enhance and enforce safety in the workplace. And we would do this when we observe something as a safety risk, we recognize as a potential safety risk, and we want to do something about it. So how can we do this? We first begin by asking a question in a respectful and non-accusing manner to alert or raise awareness of the potential safety issue to the persons involved. If that does not work, we can request a change in their actions to make the person involved fully aware of the safety risk. And if the safety risk still persists, or if the person is resistant to change, we can voice our concern to them. And lastly, as a last resort, if there is no change, we follow the chain of command and voice our concern to see through it that the safety risk is resolved. So let's try this activity. How would you approach a coworker who is doing compressions at 50 compressions per minute using the ARCC model?
Another tool to help you speak up for safety is stopping the line. When you perceive an immediate threat to safety, use a calm and respectful voice and say, "Please stop the line. I need to clarify." So let's do an activity. A paramedic is responding to a possible heart attack. The team is approaching the man who collapsed while mowing his lawn. You look up and you see a broken electric line in contact to the front yard. What do you do? Lastly, a safe nurse is someone who continues to grow as a lifelong learner. So we're going to talk about different learning methods. And there's different types. If you're someone who prefers to use pictures and diagrams to understand things, you're probably a visual learner. If words are your strong point, you're probably a verbal learner. If you use your hands, body, and a sense of touch, you might be a kinesthetic learner. So learn about yourself. Throughout this video, we have given you verbal explanations, visual and auditory cues, and activities to participate in. Out of all of those methods of learning, which one stood out to you the most? Once you find out, communicate to your teacher or your preceptor, and always actively seek out for more effective methods to implement safety in the workplace. Want to learn more about yourself? Take this quiz.
Thanks for watching. We hope you learned something from this video.
And thank you for helping us with our project.
After this, we would appreciate it if you could complete the survey as soon as possible.
Bye!